coming to the next agenda, that is hairs, like hair fall and premature graying, which is very significantly seen in today's times.
Yeah. Yes. Yes,
So,
please.
causes of what are the causes of early hair fall, and how one can prevent by in their lifestyle?
Okay, so the question is
Can
about
you hear me?
premature. Yeah, the question is about premature aging or hair
Yeah,
fall. Premature graying or hair fall.
I think we can start with the hair fall and then coming to gray.
Okay, fine, no problem. Okay, so firstly, you have to understand a hair fall can be, just the acute hair fall, or it can be chronic hair fall. Acute hair fall is something which has happened because of something which has immediately happened in your life. It can be as simple as I told you, office stress or a exam stress, or your pregnancy stress, or someone who has met with an accident recently, or some illness which has happened, like a typhoid or a viral infection. Like the best example would be COVID, right? COVID is a viral infection. So what happens is when any kind of acute activity or acute stress happens in your body, it actually pushes the three cycles into your hair. It actually gets you into the falling phase. So our hair has got three cycles. One is the falling cycle, one is the growing cycle, and one is the stagnant cycle. Now what happens is, whenever there is an acute stress, a
Okay.
lot of your hair from the stagnant cycle automatically goes into the falling cycle, right? And that is where you suddenly start seeing a lot of hair fall. So and that is even it is true with COVID also, any viral infection or stuff also. So in such case situation, you have to first understand that this is temporary. Okay. Second thing is, whatever hair has fallen because of this shift of cycle will be restored, because they will again grow into the growing phase. Okay. And third thing is that
Yeah.
you need to just do a basic care without taking any stress. Just do the basic the scalp nutrition care, which is enough. Now when we come to the chronic hair fall is something which has been, there is an underlying cause. There can be either any disorder or disease, or unharmonious thing which is happening in your body, which is resulting into chronic hair fall. It can also be hereditary, if it is there in your family, the thinning of the
Okay.
scalp or the hair fall. So in female we call it as female androgenetic alopecia, or in males we call it as male androgenetic alopecia. It runs in the family. So if someone's parent has thin hair, you can't expect them to have a luscious and beautiful and thicker hair. Or hereditary plays a very important role. Similarly, if someone has got blood pressure, diabetes, thyroid, or any other internal, which is chronic disorder or ailment, that also can result into hair fall. Because as I told you, what happens is, whenever you have some internal problem, it consumes a lot of nutrition and it consumes a lot of things into your body, and it does not let it penetrate into your outer area, which is your skin and hair. So that is the reason you start experiencing slow and steady hair fall. Now one question which many people have asked me is that, what, listen, I know the baldness and the scantiness runs in my family, but my dad and my mom lost it when they were 50, 60, 70. But now I'm only 30, or I'm only 25, and I'm only 28. Why am I losing hair? Why I'm having this thinner? Why am I becoming bald? Right? Again, the same thing comes. Their lifestyle and stress levels are very different. So if you have a habit of smoking or alcohol, or you're not sleep well, we are all social media addicts, or we have any early disorder, obesity, or anything which is metabolic in nature, the same thing which are genetic or hereditary can have early intervention, right? So if diabetes runs in somebody's family, and that, if you do not take care of yourself, and if you eat a lot of sugar, and if you are, or if you have become obese,
Yeah.
or so, you will manifest it much earlier than what your previous generation did. Similar thing is with hair fall also. So yeah, acute hair fall and chronic hair fall, Disha. Now coming about the graying, premature graying, let me just put this fact straight on the table. Your graying is determined by genes. Okay, so there is no control when and who is going to be graying. It can be as early as 20s, 30s, and 40s. But there is a condition when it happens before 20 or 19 years of old. That means, there is a very severe nutritional deficiency, which we try to correct by giving calcium pantothenate, right? So that is something else. But even if you're getting early in 20s, 30s, 40s, this is genetically predetermined that this is how it's going to happen. So what you can do is, currently there is no medicine which can actually prevent the graying of the hair. The one who discovers will become a millionaire, but right now it is not there.
Exactly,
So,
definitely. Like there is no reversal of if there are gray hairs, there are premature gray hairs. There is no reversal
there
of
is no
it because there
reversal.
are a lot of myths and a lot of oils available ki
Honestly
reverse
speaking,
ho jayega.
yeah, these are myths, but what you can do is, as I told, it also applies for your hair. If you take a good care of them, if you're having a right kind of diet, you have right kind of exercise. Now, why exercise is so important is because it actually improves the entire circulation of your body. When it does that, the top to bottom, the blood reaches even to the peripheries, which is your hair and the skin. Therefore, exercise plays a very important
Okay.
role. And also, people say, oh, I eat a lot of good diet, but you do require external supplementation, because it is not always the consumption but the assimilation which matters. So you might eat the right stuff, but how much of the nutrient is getting absorbed by your gut is also plays a very important role. Therefore, we prescribe something called as multi-nutrient therapy for our patient. Now, this multi-nutrient therapy is not the previous one where we used to give all the nutrition together. There's a concept called as cyclical nutrient therapy, where we have specific nutrients like your folic acid, your calcium, your vitamin B12, your proteins, your amino acid. So there are a lot of nutrients which are
Okay.
complementary. There are a lot of nutrients which are antagonists. So previously, we doctors used to give everything on the table, but now we realize that fact and we give specific tablets on each day, which will actually help the patients better, right? So yeah, these are the things which we can do to delay it, but you cannot say that your gray hair will not come, because it is genetically predetermined, Disha.